Chloe Kral is living the good life of a 20-something in San Francisco, studying design and enjoying what the city has to offer. But getting here has been a very long journey. Her happy-go-lucky life started spiraling downward sometime after graduating high school.
She couldn't function. She was like a small child. She was so depressed. She hadn't been getting out of bed. We just took her from a series of therapists after that. We never could get our handle on what was actually going on for her.
All throughout high school, I was really focused and, good at timing. And then once I got into college, it was just this complete change around of like, oh, well, now you're not able to, keep your appointments. And then also kind of lying around and not getting up and doing things.
After 6 years of medications and doctor's visits, Chloe kept getting worse.
She got to the point where literally she was sitting on our couch day in, day out, and she'd become literally like a small child. Like it was really bad. And I was like, this therapy thing, it isn't working. And so I talked to her psychiatrist and I was like, I can't do this anymore. Something else needs to happen. So yeah, she recommended a treatment center.
5 months into her psychiatric treatment center stay, Chloe was taken to the Cedars-Sinai Marina Del Rey emergency room for extreme bizarre behavior.
My gut instinct, something seemed a little bit off, so I decided I should order a CT of her head. And I just could not believe it. I mean, I told the entire emergency department to come look at this CT. It was a very dramatic CT scan.
Dr. Liz Mitchell was able to solve the 6-year puzzle with one CT scan.
The CT showed that she had a large amount of hydrocephalus, which is too much of the fluid that your brain makes, and it was compressing her brain against the side of her skull.
When they saw the results, they all literally gasped. She said it was the worst case of hydrocephalus she'd ever seen. That's when she called me and she said she needs an operation. She needs this to be dealt with.
Chloe was transferred to Cedars-Sinai Medical Center, where Dr. Chu performed minimally invasive brain surgery using a technique he's perfected.
She had an obstruction. So she had this area where spinal fluid wasn't flowing and just ends up that this is the spot that's great for what we call an endoscopic third ventriculostomy, or ETV. With that, endoscopically, you can put a small hole carefully through the floor of the third ventricle and it bypasses the obstruction and in a sense reestablishes normal spinal fluid flow.
Chloe's improvement started immediately and continues to this day.
For me, having them diagnose me, it means the opportunity to have the life that I've always kind of wanted and that I think I thought I wouldn't be able to have.
We don't get a lot of these cases like this with such amazing results and to make an amazing diagnosis that pretty much saved her life. And the few chances that we do get like that is really makes me love my job and makes me feel great.
That emergency doctor, when I went there that day, I just said, I want to kiss your feet. Like, thank you.